thank you so much. Thank you for joining us, representing the 9th Congressional District of New York, and also for introducing a bill that we hope will change lives, the Uterine Fibroid Research and Education Act. We are thrilled to hear about this. You know, we know that it's going to make a big difference in the conversation and in the awareness of talk about uterine fibroids. And so thank you so much for your involvement and for working to bring this up to the top in Washington is what we're hoping. So I'd like to just kind of talk about basically what we'll be discussing during this interview. Definitely the Uterine Fibroid Research and Education Act, community and involvement, fibroid awareness and initiatives, the health disparities in minority communities and access to quality health care, big one, and the impact of fibroids on women's health. So I'd like to start off by asking you a question, Congresswoman Clarke. You're a sponsor of the Uterine Fibroid Research and Education Act, introducing the bill to Congress in March of 2020, followed by Vice President Kamala Harris introducing it to the Senate. Why is this legislation so important to you?
Well, this legislation is extremely important for a number of reasons. We know that between 20 and 30% of women of reproductive age have been clinically recognized as having uterine fibroids. And the screening studies indicate that the prevalence of uterine fibroids, particularly in Black women, may be much higher. When I first came to Congress, I had a colleague, Congresswoman Stephanie Tubbs Jones, who is now deceased, who had actually introduced legislation to address this issue back in 2007. And what was ironic about that is that when I arrived in Washington, D.C. in 2007, I arrived carrying fibroids. And so it's personal for me. And I felt that, you know, for some reason, this condition, it's not something that's widely recognized. It's not something that is discussed regularly. You know, my own mother didn't really have any lens into what fibroids were. So we didn't have it as a hereditary condition. And so I thought it was important that we raise the level of awareness, education, research, and information, because as I went about my travels, I began to recognize that condition in other women. Yeah. And I understood what it meant because I had personally gone through having uterine fibroids myself. So I think that it's no secret that Black women develop fibroids earlier, have larger and greater numbers of fibroids, and even experience even more severe symptoms than their white female counterparts. So this legislation will provide for research and education on uterine fibroids so that we can find a way to combat what I consider to be a very devastating public health crisis within the crises that we all face, particularly for women in reproductive years, in their reproductive years.
Absolutely. I believe that if we can find an avenue for early detection, that can most certainly be life-changing for so many women. And with that said, I understand in the act that one of the organizations that you've mentioned is the National Institute of Health, specifically the National Institute of Child Health and Human Development. And so when we talk about education, about fibroids, now we're talking about a younger age group, which is definitely something that I know Dr. Yan has been conversational about. So Dr. Yan, one of the goals of the Fibroid Act is to create awareness about the fibroids, but definitely definitely talking about the education behind uterine fibroids for everyone overall, but definitely for those of younger age groups. You've definitely talked about educating women between the ages of 16 and 26. Why is it so critical to reach young girls during that age group?
I guess it's personal for me too. I have two girls. I want the best for them. And it's hurting to know that there's a inequality of opportunity to pursue happiness when someone we understand men and women are a little different. And women carries children, has periods, and it's a lot tougher on her body. But many women have a worse life than others because of the fibroid. It's so common. And what happens that those conditions are either not discussed or normalized abnormal. So people think it's okay to suffer. Mom, grandmother, aunt, everyone had this, it's normal. So why young? It's so common. African American women between ages of 18 and 30, 26% already have a symptomatic fibroid. Interestingly, whites have 7%. By age of 35, 40, it's 60% African American and 30% whites. And then things become more or less equal by age of 50, 80% of blacks and 70% whites. So when it hurts young women, and its most common treatment is hysterectomy, to me it's crime against humanity. You know, when we have a call, so a 26-year-old girl calls us and crying, do you have any option for me? My gynecologist recommend hysterectomy. I don't have kids, I'm not even pregnant. That hurts. You know why it hurts? Because I know different. I know that uterine fibroid embolization that can be done in the office, we do it, and based on about 4,000 successful uterine fibroid embolizations, we know that 30, 40-minute procedure, ambulatory in the office, can fix and create equality, and that's it, basically cure. There's a cure for fibroids. It's curable disease. If we attend to this early, we'll provide the full potential, and the girls will not suffer from physical symptoms, mental stress, social discomfort. 35% of women don't have a normal sex life. How can they? No family. Very difficult. And that's why if we educate early and tell about that abnormal things not normal, and there's a cure to this, and everyone can find 2-3 hours for 30-40-minute procedure, and that's done in the office, covered by insurance and majority of managed Medicaid, and just that. So this is very, very important.
Right.
And that was a miracle when I heard about this. I guess I wasn't aware about 2007. So, and we were so frustrated. We started Fibroid Fighters. We've done everything what we could, created USA Fibroid Center. Is proposed. I think we must work together. We have a solution, and you have a means that will enable us to make everyone aware of this.
Absolutely. And Dr. Jan, let's double check. Is your video screen on?
Yes.
It is? Okay. All right. Okay. So it's just.
Can you see me?
I cannot, but that's okay. As long
I can see him.
Okay, fantastic. All right, fantastic. Okay, and so, you know, with that being said, with the education aspect, Dr. Jan, let's talk a little bit more specifically about reaching out to that younger generation, perhaps through something like health education. Would you agree?
Absolutely. Health education is very important. Again, I have 2 girls, so they went through health education. That's mostly done in the physical, part of physical education. And they definitely talk about, STD. They talk about periods, but nobody talks about abnormal periods. Nobody talks about fibroids. And my girls went to schools in the South Chicago area, and they actually called the school directors, and they were approved to give a talk. They spoke with more than 800 kids, girls and boys. And when we started talking about this, girls said, oh yeah, no, my mom has it, everyone has it. And people were very interested. Today, in digital age, We have to spread awareness and make sure that everyone from youngest age is responsible for their body. How do we do it? From education, given knowledge and tools to make the right decisions.
Absolutely. Absolutely. And Congresswoman Clarke, um, for a woman who has experienced fibroids herself, when you think back on potentially having this type of information when you were younger, um, do you find support in this conversation introduced by Dr. Yon to have this type of health education earlier in school-age girls?
Absolutely. Awareness and access means the possibility of combating otherwise unaddressed public health issue. And one of the challenges we faced has been sort of the insidious way in which this condition develops in young girls. Over time, it's a compounded situation, but as a young person, you're not recognizing those changes, and we are not doing as good a job at educating particularly young women of color about their reproductive health. And it's ironic because back in the early 2000s, 2007, the procedure of embolism had not even been put forth into the public domain. So the options were either removing the fibroids or removing your uterus. And the information has to talk about at what stage one needs to seek treatment, because for many folks, they wait until life is just totally unbearable. And at that stage, you're progressing through your reproductive years. So this type of education is critical. And our primary care physicians, our gynecologists, everyone should be talking about the whole person. And for girls and women, that means reproductive health. And that's what our bill is intended to do. And I'm so glad to know that there are fibroid fighters out there that are doing that work alongside. And it's about time. This is an age-old condition. It's interesting because as a younger woman, I worked with another public servant who also had fibroids, but there was no conversation about her sharing her experience with the young women around her. So we didn't understand the significance of what she was going through, and how it challenged her as she proceeded through childbirth and a whole host of other things that she ultimately endured while carrying fibroids at the same time. So I'm hopeful that the work that we're doing here in terms of policy making in Washington, D.C., and the work that advocacy organizations and the medical professionals are doing to open up the aperture on understanding what this condition is, and then having the research done so that we can come forth with clarity around how to treat this condition. I think it's a win-win-win. And I will also say that we know that people are delaying seeing medical professionals because we're in a pandemic. And, time is of the essence when you're carrying fibroids. And unfortunately, it's those same vulnerable communities that were hardest hit by the pandemic that are delaying seeing their medical professionals, may not even have access to primary care, gynecology, may not even have access to medical insurance. So the pandemic has laid bare a lot of the healthcare disparities that exist, and embedded in that are women's reproductive health. And as a part of that is an understanding of what uterine fibroids are and how it impacts the life and the livelihoods of women.
Absolutely. And it's important that you also mentioned, conversation around the topic just doesn't exist much and hasn't existed very much. Why do you think that is? Why is it that certain medical problems such as uterine fibroids or anything dealing with the women's reproductive health system, miscarriages, topics like that just aren't really discussed?
Well, I believe it's because, we've lived in a male-dominated society for a very long time. And unless the conditions impact men, oftentimes we don't hear about it. A lot of it has to do with how we're conditioned in our society. And our society conditions us to be squeamish when it comes to women's reproductive health. And women absorb that as well. So they're not going to be as inquisitive about what is happening with them medically, particularly when it comes to reproductive health. There are so many pressures bearing down on the freedom of women to be able to express themselves, and that very significant part of their healthcare. You have a headache, we all know how to treat that. You have uterine fibroids, might have to come back later, or you might have to have a hysterectomy. This is unfortunately where we are at this stage of human development in our civil society. It doesn't have to be that way. We need to liberate women in a way in which they can get answers, that they're asked the right questions. When young women go in to see a gynecologist, why isn't that part of the questioning? Are you experiencing heavy menstrual cycles? Do you feel something different? Let me examine your abdomen for this condition. These are things that can be taken care of, but we have to make sure that women have access to medical professionals that are sensitive and also knowledgeable about this condition and how it can be treated.
Absolutely. Dr. Yan, I'd like to address this question with you first. In what ways can we support the women who are suffering from uterine fibroids? And actually, it's kind of more of a Black community as a whole as well, from a medical standpoint. How can we support women and listen to their concerns as it relates to health conditions?
Congresswoman Clarke, you said amazing things. You just repeated exactly what I was saying to everyone. If men for prostate would be recommend little amputation, that would be with fibroids, hysterectomy is illegal and recommended. This is absurd. This is absurd. Now, I want to tell you that one of the reasons when people, as a doctor, right? How do we doctors make decision? Doctors make a decision, at least should, based on risk and benefit. The same way other people make a decision, risk and benefit. So if people don't see any benefit, if all they know that you suffer, but treatment is worse than disease, like hysterectomy, and for sure no babies, it is worse than, okay, maybe everyone knows fibroids #1 reason for miscarriages, right? But okay, maybe I have a chance. Without uterus, I will not have a chance. Uterine fibroid embolization is 2% of treatments. 2/3 are hysterectomy. Third, other minimal invasive things. It's terrible. So if people will understand that there's a treatment that's easy, nothing, hour, local anesthesia, mild sedation, go home. Say, okay, this is a treatment, there's a pill. If you have a headache, as you said, people will take aspirin. They will not go for, head removal, right? But with uterus, I'm saying those things, it sounds absurd, but it's the same thing. It's bizarre what's going on with the medicine. And it's okay to talk this way. Now, it's interesting that you mentioned education, not to patients, but to physicians. See, if I'm a hammer, I see the nail. If I'm a gynecologist, I do hysterectomy, and in my hands, from options, I have mammectomy, hysterectomy. So women go to gynecologists for certain things, and gynecologist has the tools. They don't go to interventional radiologists. I don't know how many people know about specialty in the interventional radiology that actually provide procedures. Those people work in the dark rooms. But that's the progress of medicine. You see, there were surgeries, then minimal invasive surgery, but now most of the things can be treated through tiny needle hole. And interventional radiologists have a wonderful license to make holes everywhere for any part of the body. So if we'll connect the dots, give specialists who do the treatment to women who suffer, it's a win. That's why we have almost 100 locations in 18 states and 40 in New York City alone, just to connect the right doctors to right patients. Next, how do you know the benefit? You know the price is low, right? You feel nothing. Easy. What do you think is a benefit? So if you understand that it's not just a pain, but there's a lot of things physically, symptoms, especially in the minority community. African American women have a more incidence, bigger size of fibroids, more symptoms, anemia, high hysterectomy rate, and even after myomectomy, 2.5 times more complications and 2.3 times more anemia. I funded research 2 years before the bill and paid people to do the whole evaluation of literature and came up with many, many very specific answers that amazed me. How much opportunity we have to change the world. And that will explain women that it's physically, socially, not having families, not having children, mentally. If women cannot go out, wear white, go out and first thing, if they more than 15, 20 minutes outside the home, they need to look for bathroom. Why not talk about this? Small bladder, this thing doesn't exist. It's just pressure for fibroid that you need to run either to, urinate or change hygienes. It's bad. Now I want to talk about other things. I want to talk about equal opportunity in life, career, life development. Absentees, the cost of fibroids? You need to tell this to Congress. Cost of fibroids is 25% cost of diabetes. The biggest cost? Direct cost, indirect cost. Indirect cost, absenteeism. Women cannot go to work. If they cannot go to work, does it put us equal with men? Even if they have the same wages? Not. Because most people hourly employed. If they don't go to work, they don't get paid. That's how inequality builds compound, as you mentioned, compound inequality that can be fixed. So if we'll educate about different phases of suffering, physical, emotional, mental, social, financial, independence, fertility, and you have easy solution. And by the way, diagnosis can be in majority cases done by just ultrasound, transabdominal, transvaginal. MRI is good, but majority can be with a qualified ultrasound tech.
Absolutely.
And anyone can do it. So I think if we'll educate people, that would be amazing, absolutely doable. There's no unknown that we need to invent pill, invent treatment, invent vaccine. No, we have a solution. Hopefully, even better solutions will come. But
Yes.
even this solution today can be applied as long as people know about this.
Absolutely. Thank you so much, Dr. Yan. And I think one of the most recent studies by the National Institute of Health mentioned that the cost of fibroids is anywhere between $5.9 and $34.9 billion, depending on what variables you're including. But even at $5.9 billion, it is a ridiculous and remarkable number out there when it comes to the cost of uterine fibroids for either an employer or a patient or physician. And that's something definitely that has to be addressed. And with that said, that's a great segue into asking Congresswoman Clarke about increasing funding and research. How critical is it for us to increase the funding and research and public education as it relates to fibroids?
Yeah, I mean, we can't do this on the cheap. We see where that's gotten us, right? It's important that we invest in the education, the research, the accessibility to folks like Dr. Yan, who, can provide guidance to women, to young girls as they approach womanhood, so that, they're prepared with the education and information they need to navigate their own health, and accurate information. Like I said, I think we've come a long way with respect to treatment. We want to get to what causes uterine fibroids. We want to understand whether certain living conditions create the growth of fibroids. We want to get down to it so that we can unpack it for everyone, and that it's a part of our conversations. We talked about how different genders health is spoke about in the public domain. For women, it's almost taboo in our society because we have created sort of this respectability politics around women's health and women's bodies, particularly during their reproductive years.
Absolutely.
So resources are critical. We got to make sure that every corner of this nation, there are specialists and there is a connection, as Dr. Yan has said, because it's not just, as he stated, primary care, gynecology, but the allied healthcare professions that really specialize in treatment should be leading these conversations, because again, we don't know what we don't know, but there are those like Dr. Yan out there who do know, and they need far more exposure. That requires resource.
Absolutely. And I actually hear a strong connection between yourself, Congresswoman Clarke, and Dr. Yan. Perhaps there's a way for you all to collaborate to talk about how to make education about uterine fibroids widespread for younger women, and perhaps maybe talking about building some type of education program. Just hearing the both of you speak passionately about it and knowing my own experience as well, if I would have known about something like this when I was younger, perhaps I wouldn't be 2 myomectomies in right now. So, definitely want to put that out there as a possibility.
And Erica, we have a vehicle right here in Washington, D.C. Myself, Congresswoman Robin Kelly of Illinois, and Congresswoman Bonnie Watson Coleman have established a congressional caucus on Black women and girls.
Yes.
And as it would happen, Congresswoman Robin Kelly of Illinois heads up Black women's health. She's also chair of the Congressional Black Caucus Health Brain Trust. And so that's the sweet spot right there. That's the intersectionality. And we do a number of presentations. Would definitely want to connect with Dr. Yan, and we could lift up the legislation while at the same time educating and informing and bringing together those within our collective communities that have been really focused on the healthcare imperatives of our community.
Absolutely. Congresswoman Clarke, we know that you work very hard to foster relationships between the United States and the Caribbean community, as a proud daughter of Jamaican immigrants, and co-chair of the Congressional Caribbean Caucus. Many Caribbean women are suffering with fibroids. As a physician, Dr. Katsnelson and his staff see a lot of Caribbeans and islanders in the New York area. What more do you think needs to be done to help this population of women?
Well, we've said it here. It's all about education, all about education. And mind you, when you're an immigrant, you come from civil societies where some of what we're talking about is also prevalent. So that many of the women from the Caribbean region have seen other women press through, work hard, all while being, carriers of uterine fibroids. And so it has been normalized to a certain extent in those civil societies where they don't have access necessarily to the latest in terms of healthcare and health information. And in those societies as well, we're talking about male-dominated societies where, it's not, you're not readily accessible to women who would have these conversations. So I think, again, the education campaign that we've been talking about throughout this interview is just as important, and particularly in immigrant communities where, they're coming into a sort of a new civil society, the systems that are set up to provide services, they're navigating, and just learning about what that navigation means in terms of their own personal health is important. And let's also be honest here. Most women, particularly women of color, women who are immigrants, they are so busy tending to others that they don't stop to tend to themselves where their health is concerned. And that's why I think you have things get to such a desperate stage before it's addressed.
Absolutely. Dr. Jans, hearing Congresswoman Clarke speak, it made me think about my own experience of visiting your USA Fibroid centers in the New York area. And I think I just want to take a brief moment for you to just kind of explain how, I don't know if simple is the right word, but how accessible the fibroid centers are and where they're located in the US, because I think there's a tie there between the accessibility question and treatment options. So can you talk a little bit about your fibroid centers?
Absolutely. By the way, I'm double immigrant, and English my third language, and so I exactly understand what you're talking about. It's tough to be in a new country. It's tough not to understand language. It's tough to worry about your family. Women always put themselves last. And anything we can do, that would be great. I really liked your think about education. I'll answer a question about our centers, but education, because it's important to understand when you have a big problem and you start solving the problem, you at least I think, what's possible, what's not, what's known, what's unknown, what's easy, what's difficult. And let me tell what's possible. We built USA Fibroid Centers because there's a known technology that can be easily done in the office. Okay, so we have, and we work on accessibility. What is accessibility? Accessibility, it's that you have availability of location, of time. So that's why we have, for example, in New York, we have locations in 19 states, mostly in inner cities, because we enjoy helping divorced, sick patient in advanced condition. The miracle of medicine is a magic of healing, that you take someone with a big problem and will make them healthy. I liked it when I was doing the heart surgery. You stop the heart, you fix it, and it's better than before. That's amazing. Now I feel we did the same thing with the vein treatments, with the wound care, and absolutely deja vu, it's possible to do with a fibroid condition because technology is available. So if we'll build a bunch of centers, everywhere available within 1-2 blocks from public transportation. Now, these locations, how about we'll make them open 7 days a week, early morning, late evening, beyond regular business, 9 to 5 hours, because it's not about doctors. I'm an important doctor. I'm very smart. I can do this. No, it's about patients. When they were put patient first and serve them. That's very, very important. So we put locations, make them work, open 7 days a week, and provide technology that's easy, that they can go home 2 hours later and back to normal life a couple of days after that. Now, next thing, so that was availability. Next, affordability. The miracle is uterine fibroid embolization is covered by majority insurances and even managed Medicaid. There's a few minor complications. Interventional radiologists and many managed Medicaids, for example, in New York, in your district, they have closed panels. And insurance says, we have enough. And nobody wants to talk because they're thinking about heart, cancer, COPD, diabetes, big four. They don't understand 50 billion plus expenses. And you know what? If people would know that they can be helped and they have a disease instead of normal suffering, that would be $500 billion expenses because it's such a common condition. So it's affordable mostly. If we'll allow interventional radiologists not to be ever part of closed panels, because that's how insurance can allow patients to have a right treatment. Second thing, I definitely need to talk to Congresswoman Kelly, because in Chicago, it's weird. And I'll tell you what I think. It's not something absolutely bad intention. It's because didn't ask. You know, America, if you want something, just ask and bring and explain why. So Medicaid covers, managed Medicaids cover UFE in the hospital, but not in the offices.
Right.
No good explanation why. New York, almost, except a couple of states, it's allowed everywhere except Illinois. Why? I don't know. Just need to ask. So these tiny things, if we can fix, that would be fantastic. Now, imagine, let's say in New York, everything is good. You know, you have centers, you have this, but without awareness education, they're no good. Right. If people don't go there, if people go slaughter for hysterectomies, now 40 million women have symptoms. 10, 15 have a severe symptoms. 90% postpone the treatment because they're better suffering than hysterectomy, but 500, 600,000 have hysterectomies. So if we'll educate and small tweaks with the, you know, a little insurance access, you know, credentialing, a little approval here and there. Oh, I have an idea, thanks to you. Metrics. Government has mandates for things that government pays, right? You pay, you're the boss. There's metrics about blood pressure, smoking cessation, obesity. How about we'll put a metric, if government pays, please make sure you check fibroid symptoms. Make sure that, you know, why not? You pay, you're the boss. You can ask this, totally normal, totally fair. And suddenly it becomes absolutely part of examination, of every examination. Now, it doesn't matter what specialty, what doctor, you have to talk about, you know, weight, about diabetes control, about if patient has diabetes, smoking cessation. You have to talk. That's part of basic things, like checking blood pressure. That needs to be a basic thing for any woman of reproductive age. Talk about this. If Congress mandate, if that will be part of things, I think then, wow, we need to measure something, gain something new. Okay, that's the first reaction. Second, what is it about? Oh my God, how much we can, even easy options. Then doctors will know, a lot of professions will know, and patients will know. So, Congresswoman Clarke, everything is up to you.
No pressure.
No.
Actually, Dr. Yan, it's up to the American people. It's up to women. It's up to all of our allies to
Fibroid
speak up.
fighters.
Exactly, to speak up and to be aware of the Stephanie Tubbs Jones Uterine Fibroid Research and Education Act, so that increased awareness makes it an imperative. And that's what we have to do. I think that women suffer in silence. And when you're in your silo and you're suffering, you don't realize how many other women are suffering as well. And through that community of interest, we can make a lot of change. And that's why I'm in this. That's why I'm taking up the mantle, because I personally know what it is to have one's, you know, health compromised in this way, and at, you know, such the prime time of your life. And so I really want to make sure that we, again, widen the aperture, demystify what this condition means to women, to Black women, to immigrant women. to women who are suffering in silence.
Absolutely. That is just the heart of everything we're doing here, Congresswoman Clarke. So I really want to thank you